Joined by Dr. Syed Hussain of Trinity Health in New England here on our Health Watch as we are talking about where we currently stand with respect to all the different winter viruses. And forgive me, having a little bit of a microphone issue right now, but I think your microphone is working pretty well, Doctor. So yes. I'll just get my mic on yours. Good to see you again.
Good to see you too.
I don't know about you, but all the numbers I'm seeing, at least with regards to COVID and the flu, numbers are dropping, and they've been dropping, which is still a bit of a surprise, at least to me. What about you?
It's promising, definitely. Yeah. So we continue to see the trend. We see it manifest in the hospitalization rate across Connecticut, where for both influenza and COVID-19, they're steadily dropping, which is great. But we still have counties, though, just as a reminder. I hate to be a party pooper, but just as a reminder, we do have counties, several counties in Connecticut that are high level of transmission, COVID-19 transmission levels, which means, it's not a bad idea to take those public health measures into account, especially if you're high risk or you have somebody who's high risk for developing severe COVID-19 living with you.
Yes, and while the numbers of severe cases, the hospitalizations are dropping, COVID cases too dropping a lot, but they're still very high. There's still a lot of people getting sick out there. They're just not going to the hospital in quite as large numbers. All right, do you have any comments in respect to a large new study that came out looking at COVID and pregnancy risks?
Yeah, just so viewers are aware, this is a very large study looking at data from over 12 countries, more than 10,000 pregnant individuals, a fraction of them who did have COVID. This is data from early on in the pandemic, which basically confirms what we've been saying all along, that if during pregnancy you do develop COVID-19, it puts the mother and the baby at higher risk for developing complications, whether that's intensive care unit. 4 times more likely, Tim, a pregnant, COVID-positive individual will go to the ICU compared to non-COVID pregnant individuals, which is high, and 7 times more likely to die, 14 times more likely to be ventilated, which basically what I'm trying to say here is vaccination. It is really, really important to get vaccinated, especially when we see the bivalent COVID-19 booster uptake has been low.
Yes. Speaking of vaccination, the ongoing safety monitoring efforts will stay ongoing, and there's been some talk about maybe an increased stroke risk from people after they got the Pfizer vaccine. What do we know about that?
Yeah, so I'm glad you asked, because that's not true. It's the investigation done by the feds has not borne that out. I'm very, very proud of the safety mechanism that we have in place. The safety net that we cast around vaccines in this country is so robust. Yeah. It's a needle in a haystack phenomenon, and we saw this early on with Johnson & Johnson. So similar thing happened here. The vaccine safety data link late last year picked up some cases in 65 and above age group after they received the bivalent vaccine to suggest maybe we need to investigate further if there's a risk for stroke in this age group. And so an investigation was conducted. There is no correlation between higher risk of stroke and the new Pfizer COVID-19 bivalent booster. Those findings will be presented to the CDC later this month.
Did the initial concerns arise from the vaccine adverse event reporting system, the VAERS system?
It wasn't in the VAERS, but it was the vaccine safety data link. So there are multiple safety nets that the CDC casts around vaccines. VAERS didn't pick it up. The VA study didn't pick it up by CMS. And data from other countries has not picked up this higher risk for stroke.
Yeah.
So it's important that people understand. It's great for transparency.
Yes.
But this is what the safety mechanism is supposed to do, and it worked.
Yes, and it's a great example of how you cannot confuse correlation with causation, especially with the VAERS system, which is an unmonitored, well, no, it's monitored, but it's an unverified reporting system. Anybody can put anything in, regardless of whether it actually happened or not. Say some people get sick after getting a vaccine. They just use those raw data to start an investigation,
Absolutely.
right?
Absolutely.
So that's where you try to figure out if there's a real link between vaccination and some sort of adverse event. And you'd be surprised how it looks like there is a relationship when there often isn't, because it can be explained by other factors. I imagine that's just something that the U.S. and the world as a whole has been very proud of with regards to the COVID vaccines.
Absolutely.
Yes. All right. Well, Doctor, thank you so much very much for taking the time. We are going to keep going over these safety reports for the coming months, probably years, too, because we don't see this going anywhere.
Absolutely.
Good to see you again, Doctor.
Likewise.
Thank you so much.